Hello, new moms, experienced moms, and all moms to be. Welcome to another exciting and educational episode of Mama's Nest. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. My name is Fome Ejumudo. Mom, you can do this. Welcome back. Now, we all know that pregnancy triggers so many changes in a woman's body because her body is constantly growing to support and nurture the growing baby. On today's episode of Mama's Nest, we're discussing how pregnancy changes you. And as always, I'm not alone on Mama's Nest. With me here to provide her expert advice and to guide us properly is Dr. Abosede Lewu. She's consultant OBGYN at OB Women's Clinic. Welcome to the show, and thank you so much for joining us.
Thank you for having me.
It's good to have you here.
Thank you.
Also joining us to share her experience as a mom is Mobisola Orebanwo. She's a mom of 3 kids, and she's also a customer service representative. Thank you so much. Thank you for joining us. I can't wait to hear your own experiences.
Thank you so much.
Thank you. And so, why is it that there's so many changes that happens in the woman's body? Why do we have to go through so much? It's bad enough that we're carrying a baby, or good enough that we're carrying a baby. I'm not sure how exactly to put that. But then the changes that we go through, some women can't recognize themselves. Your feet are growing bigger. Your nose is out of size. In fact, it's most of the time, it's too much for a woman, but what can we do? There's almost no way to control these changes. But then I can't wait to hear from you on what to do, if it can be controlled, or if anything at all can be done. But in the meantime, Mobisola, I'd like to hear, what changes did your body undergo when you had your babies?
Okay, so for me, when I was pregnant, I didn't even know I was even pregnant at that time. I thought I had ulcer. Wow. I was going to the hospital. The doctor was like, do a test. I was like, no, I have ulcer. This is not a pregnancy sign, because I was having pain at the top of my tummy.
Of your tummy.
So, and pregnancy, you feel like maybe throwing up, or maybe...
Yes, that's the more common sign.
Yeah, so I was like, I told the doctor, I was like, no. So I was like, okay, let me just try and do a test. Then I did the test, and I was pregnant. I'm like...
That's usually the first test.
But I'm not seeing signs. My breast is not big.
Okay.
Nothing.
You were not nauseous?
No, at all.
Okay.
So it was, I think, month 3, the 3rd month, then I started to throw up. I was feeling uneasy, and I started forgetting things.
Oh.
And I had the exam during that period. I would read. I can read a whole book. Like, for me, in my school, they used to tell me, oh, if you need anything, if you want to read, if you need someone to proofread, they call it proofreading, like proofread your project, give it to Mobisola under 30 minutes. I can't remember anything. Like, tell me something, I'll tell you didn't tell me.
You did? Yeah.
So, that really affected me at that point. So, it's, and another thing is eating. Eating was a bit difficult for me.
And you normally have a huge appetite?
Yes, I could not eat. I was getting lean. Wow. I was so lean that people started asking me questions. When they see me, they ask me, are you going through marital issues?
Not a good time to lose your appetite.
Are you sick? What's the problem? Talk to me. You know, anytime my daddy comes visiting, my daddy will call me, hope you are not suffering. What's the problem? But I could not just eat. There was nothing
for every woman.
Going.
Some women put on weight, and you were losing weight.
I was losing weight. But I think at the 6th month, I started eating.
Okay.
I started eating. Good. I can eat a whole spag.
Good.
Beanie me noodles, I'll finish it. I can, I now start eating. Then on 9, I start having saloon fruit and the rest. Yeah.
Okay. Why? Why do we have to go through so much?
It was so interesting to listen to Mobisola, to see all the journey you sort of experienced in like 9 months. And you know, within the first few seconds of our talking, I just smiled at myself because, again, this is what we kind of think pregnancy should be like. Like, I must start with nausea. I must vomit. And somebody must check my eye and my palm, like they do in the movies, and then you can tell that someone is pregnant. Pregnancy changes every woman in different ways.
ways.
There are women that have pregnancies with I feel like they blaze through pregnancy. They maintain their look. Some even glow in pregnancy, while some become different human beings in pregnancies. As in, like they
become violent.
Not even only that, physically, you can literally run into a pregnant woman and not know it's someone that you know. So, and then you said something that women have to, the kind of changes that women experience in pregnancy. I think about it that when you look at a baby, at a child, when they're in your hands, you literally birthed a new life. It's almost like you brought a life out of you.
Yes.
So it's almost like, depending on the kind of person you are, the kind of body you have, your body gave what it needed to give for you to have that baby.
Okay,
so
I like that.
When we think about pregnancy medically, the changes that we talk about are pregnancy. Women, as we all know, and girls, we're hormonal beings. That's what I like to say. If you remember from when periods started, it's a roller coaster of emotions, and then you get into your reproductive age group, roller coaster of emotions.
True.
Now, for you to carry a pregnancy successfully, your body has to secrete certain hormones in a particular balance. So that's when you hear us talking about progesterone, estrogen, HCG, like all those hormones, even the ones that causes our skin color to change and gives us all those black patches, those lines on the tummy. Every single hormone in that ecosystem is necessary for you to carry the pregnancy successfully. However, how your body reacts to the presence of that hormone is what differs. So for you, it's more of those hormones or the growth happening inside me is causing me to have ulcer-like pain. For some women, it's causing them to have nausea and vomiting. It's making you lose some appetite. It's making some.
That explains a lot.
Some can eat, like you said, everything from beginning of pregnancy. So some women, confession time. That's how I know I'm pregnant. Like that appetite just go from 0 to 100, and it's not even daytime, it's at night. Like it wakes me up from my sleep like, you need to eat more and something like that. So it's like that. So mostly it's how we respond differently to these hormones, to the presence of placenta, to the presence of the baby in our bodies. And unfortunately for some women, it also goes into some medical disorders, but it's just how we sort of respond to the hormones and those changes that come with them.
And so, Mobisola, were there any preconceived notions you had about how pregnancy was going to change you? Maybe from the movies or from what you had heard people saying? What was your expectation?
I didn't really have any expectation as that. For pregnancy, I didn't have any expectation. I was just going with the flow. But the only thing I do is I check Google every month and say, I see your baby is like tomato, your baby is like banana, your baby is like coconut. I'm like, when will this baby grow big? When will this baby be like a normal baby? I'll start to check for changes, start to check, okay, am I doing this? Am I doing that? Am I feeling this? Am I feeling that? Because for me, I'm very stubborn. I don't used to go for clinic.
I catch you.
So I always check Google and check. I say, I'm fine.
Because you felt fine, but that's no excuse not to go for it. But are there any changes that are like general, like specific rather? Like these are the specific changes that a woman is supposed to go through, apart from the more general ones.
Okay, so when we sort of decided to talk about these pregnancy changes, I wanted to, for easy remembrance, I feel like it's even good for you to maybe we look at the changes that happens where we all see the pregnancy when it shows. That's the reproductive system.
That's the obvious
and then what sort of happens from head to toe. So for women, when you're pregnant, the first 3 months or 12, 13 weeks as we call it, you usually don't really see much difference in terms of how the tummy looks.
Okay.
With the exception of people that are carrying more than one baby. So if you're carrying like twins, triplets, in a few weeks, everything bobs out faster just because you're carrying more babies. If a woman has like maybe fibroids before she got pregnant, something that is already pushing the womb out, it shows earlier. But most times in the first 3 months, we don't really sort of see anything. Even you, the mother, just knows that there's maybe deep down somewhere there, but I can't feel it. Then by the time you get to month 3 or 4, if you're a very sensitive person, you start feeling the bump is starting to rise. But for most people, it's around 18, 20 weeks, they can now comfortably, or maybe 16, like, okay, I can feel my tummy is...
For some women, even at 6 months, their bump is not so obvious.
So it's not obvious to you, but to them, when they're alone, they can take off their clothes, they can see the bump, they can feel the womb is now big. Or, you know, some very slim women, some women that, or even women that are big, that have already abdominal fat, you don't even know it. You just know that, okay, this person has always been like this. And then some of them are even 9 months, you don't know. So that's one way you can know. For some women, like, so now when we talk about the systems, for some of the women, those hormones causes change in skin color. Everybody sees them and they're like, this woman is like having patches all over her body. Then the nose journey gives away some women. Like the nose just becomes really conspicuous more than it used to be before. And then for some, like you said, the appetite, everybody knows around you. Then you know, for especially those that produce excessive saliva, you see them with their little bowls around because they're always spitting in something, in bottles, in bowls. That gives women away. And then for some, again, is the breast. Breast growth itself, for a lot of women, is completed in pregnancy. So the breast gets bigger. Some it gets painful. It becomes tender. And then towards the end, some even start to produce something called colostrum, which is one healthy milk that women have towards late pregnancy. Then there's the weight gain. And the weight loss in some cases. For some, the weight gain is very, very obvious. Like some could gain as much as 10, 20, 30 kg in the course of the pregnancy. So you can obviously tell that something different is happening to them. Then the leg swelling, you know, as the blood begins to pump more blood, the heart begins to pump more blood. The blood has more, we now have more blood in circulation because it's now for the mother and the baby. So the ability to pump it is not as effective as before. So you now start seeing leg swelling. Some have these sort of big veins showing on their thighs, and varicose veins showing on their thighs, on their legs. You see all those kind of things. So, I mean, but like I said, some women now, apart from you seeing the tummy and not even really seeing clearly for those that have like deep pelvis, you don't see anything. And then you see some, they have every single thing from the head, the color, the nose, the tummy,
losing
the
their
weight,
hair,
losing their hair, craving. Weird things in pregnancy, things they ideally wouldn't crave. So normal is different from me, it's different from you, it's different for different. But generally the ones you see, the bumps and then the face, the nose, everything just changes, yes.
So, Bisola, how were you able to manage? Were you concerned? Did you get to any point in time where you were concerned? You had to seek medical help? Or how were you able to manage some of the symptoms that you experienced?
For me, symptoms, I was just going with the flow.
Okay.
Like daily. But my concern was my breast.
Okay.
Because it was not getting bigger.
It wasn't getting bigger?
It wasn't getting bigger. And
so were you worried? What will my baby eat?
Yes, I used to complain. Even when I gave birth, milk was not coming out. They asked me to put the baby. I was just like, we are suffering this baby. Because at the end of the day, we had to buy milk for the baby because milk was not coming out. And for my second child, the same thing. So I don't know, maybe it's a medical...
Did you later lactate?
Yes, but it's not... Like,
not as much as you wanted
like
to.
I can't breastfeed a baby to be full, like, oh, this baby is full. So I end up substituting with baby milk,
baby milk. But is there any way that we can manage, for instance, like the big nose, the changes to our skin? Some women get really, really dark, and they are not particularly in love with their looks at that point in time. Is there any way to manage it? Any way to manage it, basically?
So the changes in pregnancy, really, the decision to manage those changes depends on, is it a harmful change? Or because, you know, some things we consider physiological, like it's expected. And then the ones that are harmless. So when we talk about the nose thing, most times it shrinks back, at least, even if it doesn't go back to what it used to be, sometimes it doesn't shrink back. And as you've seen the story of most women, if you see their pre-baby size, and when they are done having children, it's only few women that are able to go back to who they used to be before they started having. So it's like, I mean, pregnancy takes you from being a woman to a mother. So that transition is not just in name. I think physically you also pay the price. A few women are able to like, hey, snap back. Like,
it's possible to snap back. Please.
Yes, a few women are able to. But
it's
so like nose.
It's not all women that can snap
exactly.
back.
Not all women.
And then you see the nose thing. For some people, it doesn't go back 100%.
It doesn't go back. Some women grow bigger feet, and it doesn't go back.
Even when they lose all the weight.
Longer legs.
And even the thing we talked about, which is even the color change. For some women, it doesn't go back, even when all has been done, or it takes a long time to go back. And we see that for a lot of women, that causes them to begin to use maybe products that are harmful for their skin in the long run.
I wanted to say that because I saw a post on Instagram, and the lady she's currently selling organic products for pregnant women.
So that's a target.
I wanted to ask if actually good for you to use organic product on your skin, knowing that it's natural that your skin color
For
will
pregnant
change.
women,
Yes, for
that's
pregnant
dangerous.
women. Yes.
That's dangerous because you need to be careful.
You need to know what is, because the skin is an organ. Things can actually go into the body
and
from the skin.
probably affect the baby as well.
And then, like, we kind of talked about it already. What is happening outside is a manifestation of what is inside. So in as much as they are cleaning up some of those products, the moment they stop those products, whatever is meant to happen will still happen. But for a lot of these changes, they reverse back when the hormones now go back to normal. Some, like you said, some women are lucky, everything goes back to how they looked pre-baby. For a lot of women, they really try, but it's like a lifetime journey. Even when you snap back, when it's you can tell the skin. Some have stretch marks, some have that line taking like years to disappear. So it's just for women to wear, like I said, you should wear your scars with pride. It's not easy to sort of birth life.
I'm glad you said it's not
so
easy.
You should wear, whether it's stretch marks, whether it's the change in your color. Take your time and let nature take its course while you're doing your possible best. And please, no organic. I tell you that the fact that something is organic doesn't mean it's good for you. A lot of harmful substances are in their natural form. It doesn't mean they're good for.
Nice one.
Yeah, so please, organic, not in pregnancy.
Thank you so much. We need to go on a quick break. And when we return, we'll dive deeper into how pregnancy changes you. This is Mama's Nest, proudly powered by Cousins Baby. We'll be back in a bit. Welcome back. It's still Mama's Nest, proudly powered by Cousins Baby. I'm still here with my guests, Dr. Abosede and Mobisola. Now, we've been able to establish that for every woman, the journey is different. Pregnancy is going to change you, every woman, in different ways. And that the changes to your body is simply as a result of the hormones that your body is releasing to support your growing baby. Your body is simply reacting to the hormones, and that every woman reacts in a different way. But the most common one is, when you see in Nollywood movies, the way they tell you a woman is pregnant, she throws up and she runs to the bathroom. But how were you able to manage morning sickness when you eventually encountered it?
I think because my sister is a medical doctor, so I called her and she prescribed the drug. I've forgotten the name. Forgotten. So that was what I was using.
Was it bad?
It was really bad.
Oh, I see.
It was bad for me.
And did it happen in the morning, or it can happen anytime?
Anytime I eat.
Oh.
It was not just in the morning. It was anytime. I don't know the kind of food.
Oh,
be it liquid, be it solid. It was always irritating me. And at that time, I was working in the bank. So I would just go to sit down in the toilet seat and sit down and cry and people, I didn't want to tell anybody. I can't be going about telling everybody I'm pregnant.
Did they suspect that something was wrong?
I had to leave because it wasn't easy for me.
I know.
I couldn't
Bankers
bear
are
it.
usually very busy.
Yeah, I couldn't bear it, so I had to leave work. So
I can imagine.
Yeah.
And were you always drowsy? Were you sleeping on duty?
No, at all. I wasn't. But it's just the forgetfulness and the throwing up in the throughout the whole day. Yeah.
All right. All right. I understand morning sickness does not necessarily occur in the morning. It's just a general term. But how can women manage morning sickness? I know it's really, really bad for some women.
So it's good to talk about morning sickness. So morning sickness, the name is possibly because a lot of women have those symptoms of nausea, vomiting, excessive elevation more in the morning. However, morning sickness can be very serious. For some people, those nausea and vomiting is so bad that it actually develops into something we call hyperemesis gravidarum, where not only are they vomiting, they're losing fluid, they're losing electrolytes. So they actually have to be admitted into the hospital to actually take care of that. So it's actually something that can be mild. A lot of women experience it, but the ones that go into hyperemesis gravidarum is actually something that is an obstetric medical condition that they need to manage in the hospital, correct their electrolytes. Some can't even keep food down, like
at all.
No matter what they eat, and they need to feed the baby.
Of course.
So they need to be in the hospital for like parenteral, like food drips and all that to take care of them. Yeah. But that being said, one of the reasons why I'm happy we're talking about morning sickness is actually commoner in early pregnancy. So most times you find that is in first trimester. You find that most times by the time you get to second trimester, most of those symptoms of morning sickness will actually reduce. For some women, no, they can have it throughout like
the
this
pregnancy term.
But the reason why I want us to talk about it, which I'm happy that we're going back to it, is for some women that didn't have morning sickness, they did not have nausea, they were not vomiting. And then they get to mid-pregnancy and suddenly that starts. And they just assume that, oh, maybe it's morning sickness. It could be a warning sign. Because for women that have hypertensive disorders in pregnancy, some of them actually start having vomiting, like the urge to vomit mid-pregnancy. So if a woman is like about 4 or 5 months pregnant, you were not having morning sickness, or maybe you had mild and they suddenly intensified midway pregnancy, please make sure you contact your obstetrician. It could actually be a sign of some sort of symptoms warning you that maybe your blood pressure may be going up. So please, morning sickness is morning sickness of sudden onset of vomiting from mid-pregnancy upward. It's better you go to the hospital and it's okay, there's nothing. We've checked all these things and it's just you manifesting late. But it could also be like a warning sign as well. So for women to manage it, for a lot of women, most of what they can do, if it's not for the hyperemesis gravidarum, you need to go to your obstetrician. Yes, if it's just regular morning sickness, the best most women do is dietary modification. Like you eat in bits. Don't wait until you're very hungry. You eat a lot of boring crackers, not the sweet one, because it's almost like it's the taste that triggers for some women. Some once they drink water, they just throw up. Some drink tea, they throw up. So all those things that trigger, you can just stay away from them. If you want, some will take cold water, like small sips. Like you don't take it enough to be satisfied, but you'll be. So I have a friend that used to use straw, just to make sure she's not like taking too much. But if it's regular morning sickness, it fades away like as the pregnancy is advancing. But for some women, unfortunately, it's the hyperemesis gravidarum, they have to go to the hospital. And for some, they have it for the whole 9 months. So depends on, like we said, the hormones can affect women in different ways. Yes.
Okay, so for me, I noticed that my hair was flourishing when I was pregnant. My hair grew a lot, grew thicker and all that. But I also know that for many women, they lose their hair, even while they are nursing, they lose their hair. I don't know if you experienced that. Did you lose your front hair?
Yes, my front hair.
Did you recover it back? Let's see.
I like that.
Yes,
it grew back.
How long did it take?
How long did it take? And did you pay any special attention to it? Did you?
Yes, it was frustrating for me because to me, I was looking ugly. Yes, I lost confidence in myself.
I know a lot of women go through that.
So it wasn't easy for me at that time. I didn't even want to make my hair.
Did you have to cut your hair off?
No, I didn't cut it off.
Did you treat it?
Yes, I started using hair treatments and but at the time I just used to tie a scarf. So that because it was so annoying. Like anytime I comb my hair to the back, I was always looking like all those old women. It was annoying.
But count yourself lucky. Many women, I think, don't get to recover their hair back. Like especially when it goes on through, and when they are breastfeeding, they keep losing their hair. But is there anything that can be done?
Maybe. Like you rightly said, you did recover back. For those that don't recover back, for those that is really like something very important to them, they do see hair care specialists that will sort of prescribe what they can use, products that can stimulate their hair growth back. Because some women do have the alopecia, like loss of hair, significant loss of hair. So again, when a woman thinks that it's something they should take care of, post-birth, there are products that they can use to stimulate hair growth.
And I feel in pregnancy, once you are pregnant or about to give birth, you should be very careful about the hair you're doing at the time. Yes,
that's true.
So doing Ghana weaving braids, tiny braids,
those hairstyles that put pressure on your hair follicle.
Be very careful so it won't affect
it
scalp,
or trigger it or encourage
so
it
this
in
is
any
like
way.
Like hair care, like to
that's true. That's a nice one you mentioned. Yes, that's a good one. But how can women build their confidence back? Because there are so many women in a situation where they feel like they're ugly. Oh, my nose is big now. I'm dark. I can't recognize myself. Stretch marks all over my body. For me, I never had any form of stretch marks. But now I have stretch marks on my tummy. and that kind of wrinkly skin. You see me like this, it's different underneath. And it took me a very long time to accept myself that way and start to love myself again. And then the big tummy, especially after birth, it took me a very long time to gain my confidence back, to start feeling beautiful again. And even to start feeling like I could do what I used to do before I got pregnant. It took me a long time. It took a lot of positive self-talk on my part, even if my husband didn't complain. And we also have those set of women where their husbands no longer feel attracted to them because they feel like they've changed so much. But what can a woman do to gain her confidence back?
So I'll say that one of the things I liked about this program is the fact that these conversations, we don't have them. We just sort of take it for granted. So I think this journey for a woman should start before she even gets pregnant. Because a lot of times, women, we are very interested in the end product of pregnancy. We want to have our babies. We want to have children. The family wants to multiply. But we don't really, my ovaries are quivering and all that. But we're not really thinking about the price that we're going to pay to get that baby. So again, sometimes from the beginning, knowing that this is a journey, this is a lifetime journey, and this is something that, yes, you can snap back, but I mean, snap back, you went back to your pre-baby size, but does your body go back to what your skin tone and everything? First, if you sort of know what it is, it helps a bit. Secondly is also support. And when I mean support from your family, support from your friends, support from families that have also gone through the same process. So there should be like a hand-holding process where, babe, this baby is coming. Yeah, this can happen to your skin. Know that this is normal. Know that we have all journeyed through this, and it can happen. And then for another missing link in women's care, which is one of the things that I'm very passionate about, is the mental effect, the psychological effect of pregnancy. Nobody prepares you for the post-delivery. Nobody tells you, even before delivery, nobody tells you that this is going to happen.
You don't get the full memo.
Your skin tone will change. The collagen, all those things that broke to expand to accommodate the pregnancy.
Your baby.
Some of them are not going to be repaired. So who discusses you, who walks you through the process of accepting that this is natural, this is what will happen, and then you come into acceptance of what it is before it even happens. So and then again, even post delivery, remember that once you deliver, women were like a conveyor belt. Once you deliver the baby, the attention shifts to the baby. And then you find out that everybody says, is the baby immunized? Are you breastfeeding? Is the baby eating? When the baby is losing weight,
Nobody's
you're not
asking
doing
you.
well. And then, like you said, your hair is scattered. You've lost confidence.
Yes,
so there's
it's
pediatricians take care of your baby. There are all the family members loving and over your baby. But you, literally, they just want to give you pap so that you are producing enough breast milk. So there's a gap there that doesn't help you to transition into your new version. So I would say preparing even before the pregnancy helps. Support family, friends, women that have walked that journey to sort of your spouse. Yes. And then just to also shed light on this, the fact that a lot of women feel like their partners are not as attracted to them as they used to be before they had children.
Yes.
Even for women that snap back, some studies have actually showed that for a lot of men, when a woman becomes a mother, it's almost like they compartmentalize her. It's not only about the physical change. In their mind, it's not like a babe. She's a mom. There's something that happens there.
She's no longer a babe.
Not like she's not fine or she's not beautiful. It's more of a psychological thing where they sort of put you on a pedestal of being a mother as opposed to being like someone by their side.
What do they want from us?
No, it's not a bad thing. It's not even a conscious bias. It's more of like a pedestal they place you on, like they revere you like, oh, mom, you give birth to this human being. Wow. Then there's something that happens to some of them that they transition into now seeing you more as that than as a sexual being. So it does happen. So for a lot of men too, they have to do the reverse walk to know that you can be both. But of course, for a woman that's already battling with confidence of, oh, is it because my tummy is big, because I have stretch mark? She cannot ascribe everything to, it's because I've done all that. That's why it feels like we're not attractive. But so sometimes it's the fact that you have become somebody more. For some of them, is the fact that they place what you have become more higher than a sexual being that sort of affects the physical intimacies. So sometimes it's not necessarily, well, for some people it could be that, but for some people it's beyond how we look outwardly. It's more of like the whole process.
Thank you, ladies. We're having such an engaging and interesting discussion on the many ways that pregnancy changes you. have any questions, please feel free to drop them in the comment section or send it in as a message to any one of our social media handles now scrolling on your screen. Mama's Nest is proudly powered by Cousins Baby, makers of child skin care products to support moms on their motherhood journey. Mom, you can do this. We'll see you in a bit.